Hello, good afternoon. My name is Corina Herrera Loera, and I'm joined by Maribel Martinez. Just want to take an intentional, just deep breath on this Sunday afternoon. So beautiful out there. If you can all join me in just taking an intentional breath at the count of three. 1, 2, 3. Feels so good to be alive and be here with you all. Today we're going to be discussing the vaccine, all the new announcements that came out this week. I know a lot of people had a lot of great questions, so we look forward to getting to those. But before we get to the questions, I'm going to go ahead and open it up to Maribel Martinez, who's also a public information officer with our county, to do a brief presentation as to where we're at with vaccines now in the county. Welcome.
Wonderful. Thank you, Corina, and thank you to everyone who's watching through our Facebook page and YouTube, and for all of those who sent questions ahead of time through text, email, and WhatsApp. Hopefully in this presentation, most of your questions will be answered. I know we'll still have time to do some specific questions, and of course, as the presentation goes on, please feel free to write your messages and your comments and questions in the comments piece of the Facebook event. So we'll go ahead and start our presentation. Great. So as you all know, the first dose of Pfizer COVID-19 vaccine was administered in December. So we've had a couple of months now that we've been administering vaccines here in Santa Clara County. And these vaccines have been approved by the U.S. Food and Drug Administration, the FDA, and it's also gone through the different requirements from the Center for Disease Control and Prevention. They're the ones that oversee that vaccination process. And then that information and the number of vaccines is given to the state. The state is actually the one who has been drafting the guidelines. They're the ones that receive the vaccines from the federal government, and they're the ones that distribute to local health departments, to state entities, and to multi-county entities. So a lot of the decision making is actually happening at the state level, and counties are then given that guidance of how to distribute. So again, here you see the different processes, right? From the federal government to the state health department, and then to the local health department. Which here is our Santa Clara County Public Health Department, who then give those allocations to the different providers here locally, and also have opened up vaccination centers across the county. And really the county's role is the logistics planning to prepare for effective distribution of vaccine that's provided by the state of California. And we provide the capacity assessment, equipment, and some of that staffing to make sure that these vaccination sites are up and running. We're still in the phased approach to the COVID-19 vaccine. We have limited amounts of the vaccine. The prioritization system was set forward by the federal government and refined by the state. So these tiered systems that you're beginning to hear about, our county does not set those systems, those tiered systems, or who is eligible within those. Those are at the state level that are also informed by our federal level. And the reason why we've been able to move so quickly and have a vaccine so fast is that we've also had experience with H1N1. We've had experience setting up vaccination sites from H1N1. Our county health department is also, and all over our state, is also taking into equity considerations. We are working with partnerships with different organizations and our stakeholder group, and you'll hear a little bit more about that. And we are also looking for risk reduction as we continue, and are still encouraging people to wear a face covering, to keep social distance, and to get tested. Super, super important that people continue to get tested as an effective strategy to stop the curve and stop the spread of COVID-19. So only 2 right now vaccine brands are approved here in the state of California in the United States. That's the Pfizer mRNA and the Moderna mRNA. I added a couple of others that are still in process. Some of them were expected to be approved in January, but they still have not, including the Johnson & Johnson one that still can't, that they still have not approved yet. And so just wanted to give you a snapshot that there are others on the way. They're still being tested. They're still going through the rigorous vaccination process. The only two that have been approved are the Pfizer and the Moderna mRNA type of vaccines. To go a little bit deeper into these two types of vaccines, they're very similar in many ways. They require 2 doses. They have already been authorized in the state of California and by the US FDA. They are at the 95 or 94.1 effective, depending on which brand. So very, very high effective in preventing COVID-19 illness and symptomatic illness. And the most common side effects for both vaccinated to get some pain or swelling, and then throughout the rest of the body, some chills, tiredness, and headache that last for a very short amount. Could be could be a couple of hours, could be less than a day. And the main difference between the two is that for the Pfizer brand, you get the second vaccine 21 days after your initial. And for the Moderna vaccine, it's 28 days. So it's about a 1 week difference between those two in terms of when you get the second vaccine. Who is eligible right now for the vaccine are healthcare personnel and staff and residents of long-term care facilities. The state has this tier, this phase and tier. So we're in phase 1, tier 1A, tier 1, 2, and 3, which is all our healthcare employees, including those in acute hospital, correctional facilities, our paramedic, EMT, folks who are in-home support care services, all public health field staff, specialty clinics, laboratories, and dental and other healthcare clinics. Who is also eligible right now is in 1B. People who are 65 or older are eligible right now. And public sector populations will become eligible starting on the 28th. They can begin to receive their vaccine on the 28th. And those are folks who work in agriculture and food, education and childcare, and emergency services. People 16 to 64 who are deemed high risk are at the critical judgment of healthcare providers starting on the 15th of March. And that is healthcare providers can make that decision to begin to administer those to their patients. Who is considered very high risk? Again, this is for that population at the discretion of healthcare providers, is those who have the following illnesses: cancer recurrent with weakened immune system, chronic kidney disease, stage 4 or above, chronic pulmonary disease, oxygen dependent, Down syndrome, a solid organic transplant leading to a weakened immune system, pregnancy, sickle cell disease, heart conditions such as heart failure, coronary artery disease, but not hypertension, severe obesity with a body mass index higher than 40, type 2 diabetes mellitus, and any other developmental or high risk disability with one or more of the qualifying criteria. And again, this is at the critical judgment of healthcare providers. Just so that you all know, as part of the vaccine process, there is a vaccine committee stakeholder group that consists of various nonprofits, business, labor sectors, faith community, education, community groups, and community health centers. And they all working together to make sure that the outreach is as robust as possible, that we are looking at the distribution with an equity lens to the extent that we can control distribution at the county level, and to really look at how we can support our community members. Our information is on our vaccine page, that you can find actualized information about who's eligible, where to sign up, how to make your appointment. And lastly, I just want to share too that we want to make sure that people are going to the right locations and that are not victims of any fraud or scams. So you can't pay to put your name on a list to get a vaccine. That's a scam. You can't pay to get early access to the vaccine. That's a scam. And nobody will ask about your Social Security, bank account, or credit card information when they're scheduling your vaccine. That is a scam. So please do not fall victim to any of the scams related to COVID-19 vaccines. And lastly, what we're trying to really work for is everyone to get vaccinated, as many people who want to get vaccinated to get vaccinated. We're doing it in a tiered system because we have limited amount of vaccines. And so we're distributing them to those who are most at risk of exposure. And so it's going to take a while for us to reach what was called herd immunity, where a majority of the people around us will be vaccinated and will not have any COVID symptomatic illness because they've received vaccination. We're several months away from that. We're still in the rollout of our phase 1. And so it's really important that we move through this phase quickly. So for those of you who are saying, I'm waiting for my turn is not coming fast enough, I encourage you to support, encourage, motivate those who are eligible right now, perhaps in your network, to go get vaccinated. The sooner we can move through these phases, the sooner we can get to the others. That's all also to the extent that we have supplies to vaccinate. Right now, we are in our phase 1 and extended 1B, 1A and 1B, and starting on the 28th, we'll have the expanded 1B to those additional workforce populations. And so let's get as many folks who can get vaccinated with that eligibility possible so that we can then move on to the next groups. And with that, I will go ahead and we'll turn to questions.
Great. Thank you so much, Maribel, for that information. Yes, we have over 60 questions and or comments, so let's get right to it. And we are going to do our best to get through them all. So I'm going to go ahead and start with our first one. I see that on March 15th, health providers can begin to invite people ages 16 to 64 with certain health conditions with vaccine appointments. My mother is 64 with health risks and has Kaiser insurance. Can I schedule her an appointment at a county site after March 15th, or does she need to go through Kaiser? Does she need a doctor's note to get a vaccine at a county site after March 15th? How does that work?
Yeah, so the protocol on this is still forthcoming, and as we get to the closer date, we'll know a little bit more. But for now, the state guidance is that it'll be healthcare providers that are going to be inviting those high-risk condition population to get vaccinated. So you'll most likely see something coming from your healthcare provider saying that you're eligible in that way. So we encourage patients to talk to their healthcare provider to find out how that specific provider is planning to notify patients that they'll become eligible.
And she's also wondering if she can get on the list before March 15th.
So there isn't a list. We don't have a wait list for this. There is a list if you go to myturn.org. Let me just make sure that I'm giving you the right website. It is the state website, myturn.ca.gov. And that actually tells you if today you're eligible. So you put in your information, and then it'll actually give you the option of signing up so that you can be notified when your turn is ready.
Thank you. So I'm going to alternate between the ones we've received and those that are joining us live today. So thank you for joining us. Mariano Perez, I see your question. Are you turning people not eligible for the vaccine away if you have leftovers about to expire? If I got right before you closed at the Levi Stadium Vac Center.
Yeah, that's a great question. We are hearing that there are several no-shows, and that makes it unpredictable if we have leftover vaccines or not. So each vaccination center has a different way of reducing the amount of vaccines that are there. So you'll see that impacting in the scheduling. And so it is at this point not recommended for you to show up if you don't have an appointment, and not to show up if there's not a vaccine there for you if you're not eligible.
Thank you. What documentation will a person need to show at a vaccine site to verify that they are an eligible food worker? Is a badge enough? A time card, a business card, a pay stub? I'm going to read all 3 questions, and then we've also had several questions in regards to the teachers. So if you can also, when you're answering it, think about the teachers. Is a person that volunteers for food providers such as food bank also eligible? If so, would a letter from the food bank be sufficient documentation? And will food workers that work in Santa Clara County but live in another county be eligible? So food workers as well as teachers, please.
Great. Those are great questions. And let me clarify a little bit. So the first wave of vaccines for healthcare employees were for folks who worked in Santa Clara County, were eligible. If they worked or lived in Santa Clara County, were eligible. And this is because the state had created the allocation of these vaccines based on that criteria. The allocations for vaccines moving forward are based on county numbers of people who reside in this county. So for the next phase, for those who are 65 and older, for those who are in these workforce populations, you have to live in Santa Clara County. So you have to, in some way, show that you reside here in our county. These are not, you don't have to be a legal resident. You don't have to be documented in that way. You just have to show proof that, yes, in fact, you live here. For those who are qualifying because they are an employee in one of these sectors, what you would need to present there is that you will have to, on the form, you will need to attest under penalty of perjury at the vaccination site that you are eligible. You won't need to bring a work badge or a time card, but you will need to show proof that you live here in Santa Clara County. And that's usually with an ID of some sort.
Okay, great. And I just want to acknowledge the Spanish question, Mariscos La Ceiba. We will be having a Spanish forum soon, and we are focusing on the vaccine questions today, but we will definitely keep your question on our list and make sure that we answer it in the future. So the next question, I'll move on to Gail.
Entonces, en español, la pregunta en español se va a contestar en la presentación más en la tarde, y sea en español, pero la vamos a conservar en la lista.
Y también nada más para añadir, ahora nos estamos enfocando en las vacunas, y la lista de preguntas puede ser que hagamos un foro comunitario nada más para negocios, pero no se nos va a olvidar su pregunta. Gracias. Coming back to Gail, where can teachers get their vaccines now?
So in the county, we don't have the vaccines for teachers will begin on the 28th. So beginning on the 28th, and for those who are getting ready for that date, vaccination slots open 7 days prior to the date, so they can begin scheduling or looking at when to schedule starting tomorrow. And so in Santa Clara County, people can get vaccines if they're teachers starting on the 28th.
Thank you. Next one. I'm wondering with the news that immunocompromised people being the source of variants, why is the county not prioritizing those the CDC has deemed at high risk due to medical complications and potentially stop new variants before we have to develop new boosters? Also, why not focus on those most at risk and prioritize teachers over the summer?
Great questions. And I think as we're learning more, we might see some changes. But at this point, we're following the CDC guidelines and the directives set forth by the federal government. We're following the state directives on the prioritization. And definitely, folks who are immunocompromised are in the higher priority. And those healthcare providers, starting on the 15th, will be able to reach out to those high-risk population, including those immunocompromised. And we may see that change as we know more about these variants. But at this point, that is a directive that we're following from the state.
Okay. And the next questions I see here on the list from Jose Luis, Andrea, are regarding store retail workers and janitors. When will they be added to the vaccine list?
Yeah, those are, if you are in those essential worker categories, the state is the one that is creating those guidelines. And so we definitely encourage folks to look at both at our county site and on the state vaccine website to see the detailed list of all of the essential workers that are having those first priority. For example, if you're janitorial that's connected to schools, you are in that broad, expanded educator schools workforce. And so you will begin to see that those being implemented in the 1B.
Thank you. And the next question, you already answered a little bit about the high risk population, but the next part of their question is, what is being done to resolve the issue of people being able to book multiple appointments when scheduling online?
Yeah, that we are definitely working on that. We know that to have the most effective distribution, we need to have the most accurate count of those who are coming in for the day, and double booking has been a factor. We have remedied that by making it really easy for people to cancel their appointment once they have found one that works for them, and in terms of timing and location. And so that's one of the parameters that that we've definitely been working on over the last couple of weeks.
Great, thank you. The next question we have from Nikki Armstrong Merrick. How soon after a vaccine are you protected?
So this is a little bit of a complicated question because the protection varies, and it varies by your own immune system and the way in which your immune system responds to the vaccine. So that takes a while for that to happen. And again, during the first dose, you are protected minimally. After, typically, about 7 to 10 days after you receive your first vaccine, but you're actually not going to reach the full efficacy of the vaccine until your second dose. And then, again, 7 to 10 days after that second dose. So it's going to be depending on how soon your body can build those antibodies against COVID-19, but definitely getting the 2 dosages of the vaccine is the way to do that. And then you're protected up to 95, 94% against COVID-19 symptomatic illness.
Thank you. And the next question was around childcare. We had several questions in regards to childcare as well. And so basically, what constitutes as a childcare, especially when we say informal childcare worker? And then also, what kind of documentation will they need in order to have an appointment or a vaccine?
Can I say that one more time for me, please?
So the childcare, informal workers especially. So we had several questions regarding childcare. Who constitutes a an informal childcare? This specific person gave an example of her 63-year-old grandparent who, provides childcare for many of her grandchildren. does she constitute as an informal child care worker? And then what kind of documentation will they need in order to make an appointment for their vaccine?
Great question. So the informal childcare is the same as a license exempt childcare that is written into our California Health and Safety Code. So if you meet the qualifications for that informal childcare or the license exempt childcare, then you are eligible through this phase. The state actually creates those definitions, creates those guidances. So we are actually encouraging the state to be a little bit more specific and to answer more explicitly who qualifies under that, so that so that it's easier to read for everyone. And as I mentioned earlier, if you qualify under any of these workforce populations, you will have to attest under penalty of perjury that you are eligible under that workforce population.
Thank you. And then we have a couple of comments here from Tony, who mentioned, you do not have to convince me, just speed up the process so I can get vaccinated. I'm 62. Great to hear. I know, Maribel, you said that, if it's your turn, get your vaccination. If it's not your turn, support somebody that has, so that we can get to the next tier. So thank you, Tony, for that. Definitely excited that you joined us today. And hopefully you're able to support somebody to get their vaccination so we can get to you soon. And then Ray mentioned, Gail, I was told by a highly reputable source, we teachers can sign up tomorrow, February 22nd. And as you mentioned, that's true. If you fall under that eligibility, you can start booking your appointments tomorrow.
Yeah, you can register starting tomorrow, but your vaccine date will have to be on the 28th or later. But you can begin the registration process to secure that appointment slot.
And you will see the information to schedule on the sccfreevax.org as well, where you can start registering tomorrow. Thank you. And then Marla, I don't want to say the last name wrong, but Zamzik maybe. When can under 65 and healthy can get a vaccination?
So under 65 and healthy and not part of any of these workforce, you will be in phase 2. We don't have a set date for phase 2 just yet, but I will say that the sooner that we can get through the already established and eligible groups, the sooner we can move through. So the reason why we were able to do the expanded and are moving into this 1B is because we have vaccinated over 50% of those 75 and older. And so because of that, and because of the supplies of vaccines that are being sent to our county, we're able to then expand to new tiers and groups for eligibility. So the sooner we can get through, we are definitely encouraging people to reach out to folks in their networks, particularly seniors who may be, or anyone who might have challenges through the booking process of registering for a vaccine, for folks to reach out and support each other, as well as to call 211 or go to our website, so that the sooner we can get folks who are currently eligible, the sooner we can move forward with the next group of eligibilities.
Thank you. And the next one you've kind of answered, but it's specific to the nonprofit Affordable Housing Corporation. And so I'll go ahead and read the question. We have the pleasure of serving our residents of diverse backgrounds, including individuals, families, seniors, those with special needs like chronic and mental illnesses and development disabilities throughout Santa Clara County. It would appear the majority of our staff, if not everyone, falls under the phase 1 category as either workers in education or emergency services, or both categories. As we understand, the vaccine will soon be available to these groups as early as February 28th. We are wondering what proof of this status is needed to bring with us to ensure we are not turned away from a vaccine. Pay stub, 403B status, proof of funding for educational activities. And then there was another one in regards to after school programs. So if we can just answer the question in regards to also enrichment after school programming for staff.
Yeah, so again, you know, the qualifications for these workforce groups is coming from the state. So definitely looking at our county website and the state website to see if your role or position is under those that are qualifying. And when you make your appointment at the registrations at the vaccination site, you'll have to attest under penalty of perjury that you are in fact eligible through this workforce qualification. What you will need to show at the vaccination site is proof that you are a resident of Santa Clara County, that you reside here, and that could be done through an ID, through a pay stub, through any of these other things. But for that workforce eligibility, it is your attestation.
Thank you. And we have this question from Zoo Carpenter, and actually it coincides with the next question I have on my paper here that was emailed to me. What do you need for proof as a cognitively impaired and medically complex individual at the time of the vaccine? Yeah, so similar question to the next one. High-risk health condition.
Yeah, so folks who are qualifying under the high-risk health condition, they will be contacted, or you should inquire with your healthcare provider. Healthcare providers are the ones that are going to be rolling out those specific vaccines with their critical judgment. And so that would be the line of action that I would recommend. If somebody is a caretaker of somebody from the regional center's consumer, then that regional center can provide you a letter as a caretaker, and you are eligible under the 1A. So you would be eligible right now if you are a caretaker of somebody who is a consumer of one of the regional centers.
Thank you. The next one, I got the first shot a week later, and a week later developed COVID arm, itch, and then large red swelling, a spot that lasted about 4 days. Is it okay to get a second vaccination? Will I get the same reaction? Should I get the shot in the other arm? Should I wait and test? Should I wait at the test site longer than 15 minutes after the shot?
Those are great questions that would probably be a great conversation to have with your medical provider, your primary care doctor, to just explore what could have been some of the possibilities, and if in fact that there was perhaps a minor allergic reaction, and what would be the pros and cons for getting the vaccine. But it sounds like for the most part there wasn't any complications in terms of overall health or breathing or anything like that, but definitely something that I would encourage you to discuss with your doctor.
Thank you.
And if you don't have a doctor, then definitely calling our Valley Connections line, which is the County of Santa Clara Valley Medical Center, that you could talk to an advice nurse about that as well.
Thank you. And then I see Kristen Yamada's question, which I know we've kind of asked already, but I think we get to hear this over and over so that we understand the answer. What proof do those that are educators need to show? I am an educator and also help with emergency food distribution.
So the only thing that you'll need to show is that you reside here, that you live here in the county, and you'll need to attest under penalty of perjury that you are qualified under the parameter of an educator, school employee during this phase.
So an additional question on this one is, would a badge or paycheck be enough to qualify that next piece that you mentioned?
So the badge or the pay stub would be one of the things that you could show to show proof that you are a resident here. Also, you probably need to have some sort of ID as well, picture ID that says that who that is, because you are receiving a medical treatment.
Okay, thank you. The next question, I work in pharmaceutical manufacturing in the Bay Area. Am I eligible for the vaccine?
Say that again?
I work in pharmaceutical manufacturing in the Bay Area. Am I eligible for the vaccine?
If you qualify under this larger healthcare and including pharmaceutical, then you would be eligible. These are folks who have a potential of becoming exposed to COVID-19. If your type of pharmaceutical employment is not related to that, then I encourage you to go on the state website and look at myturn.ca.gov to see when your turn is coming for the vaccine.
Thank you. So the next question, it has two questions, and I'm going to answer the second part before you answer the first. So she's wondering if she can view the responses to these questions at a later date. And so we are recording this. This will be available for you to watch on YouTube or here on Facebook in the future. If you want to use it with, any groups that you might come together with, maybe schools, other teachers, you are more than welcome to forward and share this video as much as you'd like. And so the first part of her question is, will graduate students who perform essential in-person research be considered eligible for the vaccine in Tier 1B?
So at this point, all employees of universities, community colleges are eligible. So if you are employed by the university, whether it's as a full-time professor, a staff member, or a TA, then you meet the eligibility for that tier.
Thank you. The next one we have here from Jennifer Crump Antonow. Now, welcome, Jennifer. Her question is, how is SCC allocating leftover vaccines due to no-shows?
So each of the sites have a process, and part of that is also having a strong management of the appointment process to reduce the number of unaccounted for vaccines. This is in large part to allowing folks to cancel their appointments and have easy rescheduling, and so they are being distributed to those who can enact or who can act on them at that point. They're not planned in advance. They're actually distributed in a very far and less frequent availability with a very, very specific window. And it's uncertain if any will be available in the future as we tighten up our appointment process.
Thank you. And also I would just add, so very important that when you make an appointment, you keep your appointment. I think that's another thing to make sure that we keep our appointments. The next one is, who is considered in the emergency services sector? I currently work as a security guard. Am I qualified?
Yeah, so again, some of these qualifications are coming from the state. And so the state has a robust list of all of the essential workers that are qualified under 1B. Those are the infrastructure essential workers. And so we are definitely asking the state of California, and we hope to provide a very robust and explicit list of everyone that is part of that. So again, these directives, these definitions are coming from the state, and as a county, we are responding to those and making those vaccines available with the state guidance.
Thank you. And we have Andrea Faisal here, who's asking again about the teachers who work in Santa Clara County but live in a neighboring county. And I know that you've answered that. I don't know if you want to remind folks what that is.
Yes, so you should be getting vaccinated in the county that you live in. Even if you work in a different county, your vaccinations at this point are allocated based on the county that you live in. So you should be able to get vaccinated in your county system, as this is a workforce that has been deemed eligible by the state of California. And in Santa Clara County, you can start making your appointments starting tomorrow to begin to get vaccinated starting on the 28th. You'd have to check your county or the state to see where you can get tested. There are certain jurisdictions, certain counties. So if you are looking for where you can get vaccinated, what is your county's system, definitely go to myturn.ca.gov to see more about are you eligible and where could you get vaccinated for those who are eligible right now.
Thank you. We had this person mention that a relative called to make an appointment using the phone number 970-2000. Her social security was asked. Is that common? And what happens if she did give her social security number?
So we would have to look into why that was being asked. Perhaps they are a Valley Medical Center patient, and that was one way to retrieve their file, because if they are a patient, they'd be getting vaccinated through their healthcare provider in that way. I'd have to know a little bit more about the circumstances, and we're happy to follow up as to the experience that they had with this caller.
Thank you. We have Jennifer here again, who mentioned or is asking, how should someone with stage 4 cancer see if they're eligible come 3/15?
Yes, I would definitely encourage you even now to start approaching that conversation with your healthcare provider, whoever you're seeing to get treatment. They are the ones that are going to be at their discretion, using their critical judgment, beginning to vaccinate individuals in that high risk illness category. So definitely talk to your healthcare provider about what is their plan and how could you be able to get that vaccine through them.
Thank you. And the next question I have through email, which kind of coincides with Leslie's a little bit, Henson's, thank you for joining us, by the way. In regards to the teachers, what about the teachers? I have this person here mentioning that given how many teachers are other essential workers in Santa Clara County are commuters from outside county, particularly for housing cost reasons, why would the county limit vaccinations based on employment in this way?
So it's not limiting based on employment in this way. You are to get vaccinated in the county in which you reside in. So we definitely know that a lot of people commute. And so though you do not need a commute to come get your vaccine, you're going to get vaccinated in your county where you live.
Thank you. And then just to answer a little bit, also, I'm sure the person that has been tuning in and heard, starting tomorrow, teachers can start making their registering to get their vaccines after the 28th, if you live in this county. So just repeating that because I know that question has come up several times.
And I just want to clarify for Gina that posted a comment. The eligibility for university employees is under the 1B. When we begin 1B, they're not eligible right now. They're eligible when 1B begins on the 28th. So thank you for that. If I said anything contrary to that, that is the correct one. They're in 1B. They'll be eligible with the workforce populations.
Thank you. And I have this other question in regards to going out of county to support family. This person's wondering if they can get their second vaccine in another county or delay their shot by 2 weeks if they have an emergency.
That's a great question. We are definitely seeing examples or cases like this, and we're trying to work out what might be the best and most effective plan. And so this is one that we're definitely going to inquire a little bit more about and do some learning, and then be able to provide the most accurate response, because it does require cross county travel and a couple of other things that we definitely want to make sure that we get you the right information.
Thank you. And we have several comments here. We have one from Tony Bongfiglio Veteri. I also am aware that some people are not being truthful about their emoluments and going to FEMA site because qualifications are not checked. The soldiers only check to see if you have a QR code appointment confirmation, especially under food agriculture employment. Thank you for your comment. We have another comment. I have a family member from Miriam Martinez. I have a family member eligible as an agricultural worker. However, your website doesn't let me schedule. How can I get him an appointment?
Yeah, so the appointment will begin. You'll be able to schedule this appointment starting tomorrow for an appointment on the 28th or later of February. So this agricultural worker currently is not eligible. They'll become eligible on the 28th. Our appointment system allows you to make an appointment 7 days in advance, which is why it'll open up tomorrow. And you'll be able to do that. If, as you're going through the vaccination appointment process, sites or dates are grayed out or you're ineligible to make an appointment, it's because those slots or appointment slots have already been full and booked. So keep trying, and also feel free to call our call center at 211 to be able to schedule your appointment for the 28th or beyond for those who qualify under 1B.
Thank you. Do volunteers at food distribution sites count? Does informal childcare include family members who provide childcare for free?
Yeah, so that's a great question that we're actually looking to see. Right now, the information that we have from the state only says workers and employees. We're digging a little bit deeper to see if that also includes volunteers. Again, these are definitions and directions that are coming from the state to the county, and so we will do our due diligence to see if we can find the answer for that question.
Thank you. And we have this question from Mary Craig. Why are DoorDash drivers before those in the personal care industry? You had us shut down for 7.5 months because of the supposed risk. Why is someone who stays in their car and drops off something at my door more important to get vaccinated than those who work with the public?
Yeah, I can definitely see your frustration, Mary. And, I think we would all want to get vaccinated as fast as possible. Unfortunately, that criteria is coming from the state. It's not something that is within our county jurisdiction to, change who is under those tiers and who is under those eligibilities. I definitely encourage you to share your opinion with the state legislation, with our governor, with our state public health department, and share exactly as you shared with us.
Thank you, Maribel. And I just want to go back a little bit to the question regarding the second vaccine in another county or delaying that. Not sure and I don't know that we know the specific, answers in regards to another county, but I'm not sure if we actually answered that directly because I know there were several questions in the same question list.
So we did it, and because we need to do a little bit more, and the vaccine intervals, those are the minimum days that you can wait to get your second dosage. It is recommended that you get your dosage around those intervals, but you can get it later if you absolutely needed to. But we are also looking into, could you get vaccinated at another county? I think that might be a logistical issue to show that this is your second dose. But we are looking into, because we know that a lot of folks either move or have to travel to different counties, and want to make sure that we give you the most accurate information possible.
Thank you. I'm going to go on to Simon Gordon's question here. Why are we vaccinating teachers but not the at-risk parents of their students? Why did we prioritize 50 to 64-year-olds? Why vaccinate healthy teachers and farm workers and not at-risk people?
So we're doing a little bit of both. We are vaccinating teachers and those in industries where they are at risk of exposure. And so that's one of the folks in that Tier 1B. And then starting in March, then healthcare providers will be reaching out to folks exactly as Simon mentioned here, folks who are at higher risk because of pre-existing conditions to also get vaccinated. These are directives coming from the federal government and the state to counties on how to roll out these vaccines. And of course, everyone is highly important and needed in our communities to be safe. And so these tiered process is helping us move through that in an organized manner. And the faster we can get through folks in these tiers, the faster we can get to the other groups as well.
Thank you. The next question, which kind of has been asked, but this person asked specifically, could ages 60 plus be prioritized?
So right now, again, these these tiers are coming from the federal government and the state. For those who would like to see that change, I definitely encourage you to talk to your representatives at the state level, at the federal level, to talk to the California Department of Public Health. They're the ones that are making those decisions. And of course, they're a lot of what we are doing at the county level is making sure that once we have those directives, once we have those guidance from the state, that we're able to distribute them locally and in an equity manner to the folks in our communities. So we're also learning as we get more information about COVID-19, about what's working in our communities, including the activation of community sites, pop-up sites, mobile sites, to make sure that we're reaching folks who are most in need, and perhaps folks who otherwise could not come to one of the larger vaccination centers, but are eligible right now. And so there's a lot of strategies that we are using to make sure that the most vulnerable and the of exposure to COVID-19 and the ones who are most vulnerable to significant health impacts if they do get COVID-19 are the ones that are being vaccinated as soon as possible.
Thank you, Maribel. And I just want to note that we have about 5 minutes left here, and we have several other questions. And so obviously the need for having another community forum on just vaccines. And so just for you all that are tuning in, that we are thinking of having this every other week, bi-weekly. We do have several topics that we want to touch on, but we know that vaccines is very important right now. So tune in for another community forum on just vaccines. Like I mentioned, many of the questions might not be answered today, but we will definitely go through them and ensure that we add them either in our presentation for the following one, or also look out for posts from here to then too. We'll make sure that we'll be answering these questions throughout our social media pages and news, press conferences, etc. So I do see another comment here from Simon, a couple comments in regards to high risk, which I think you kind of answered, but I'm going to ask this next one here. Why are you vaccinated? Oh, I think you answered that as well. So let me go back up to Kat Tucker's here. Question about time between first and second dose for Moderna vaccine. My husband got his first dose at the county and they booked a second dose for 33 days later. Why is this outside of the 28 window? And I know you kind of answered this, Maribel, but if you can maybe mention that again.
Sure, that 28 window is the minimum days between the first and the second. There is no maximum, although we try to keep it closer to the 28 to get our bodies to be trained in that way to create the antibodies. So the 33 days is perfectly within the acceptable range, and your husband will still have the same efficacy of the vaccine as if they were gotten on the day 28th or day 29th. And so that's still very much acceptable.
Thank you.
And thank you for getting vaccinated.
Yes. I do see several thank yous on here. Nikki Armstrong, Merrick, I think we answered. It was one of the first or a couple questions that we answered. Thank you so much for tuning in. We're doing our best to answer questions, as you know, here live in this new way. So thank you so much. And I know a couple of you also tuned in and said, thank you for the answer. Thank you for waiting for the question. I think, Maribel, maybe we'll take one more question and then have any closing comments that you might have. And just for those of you who might have also family members or community members that speak Spanish, just stay tuned. We will have one at 2:30 in Spanish on our Spanish Public Health Department, County Public Health Department Facebook page. So Maribel, let's see, I will ask this one down here from Mitzi. I got canceled for second Moderna February 20th through 23rd due to no vaccine. Why are pop-up sites vaccinating here in Santa Clara County?
Yeah, I'd have to know a little bit more about where this cancellation happened, if it was through your healthcare provider or through one of the county sites. I know that anytime we do a cancellation, we try to do as much as possible, get you a rebooking very, very soon. So I would love to learn a little bit more and figure out how we can get you, if you haven't already, get that second vaccine that you need.
Thank you, Maribel. And with that, thank you so much for answering all these questions, Maribel. It was like, go, 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 go. Great job. I know there's still so many questions out there, valid questions from our community. And so, as I mentioned, stay tuned. We will come back and have another community forum just on vaccines again. Hopefully, we'll answer your questions between now and then. Look out for that too. We'll do our best to get back to you on the comments at least. If not, stay tuned for that community forum. As I mentioned, we are having one in Spanish at 2:30. So for any of you that might have grandparents or parents or community members that speak Spanish, that might be able to understand this information better in Spanish, we'll have it at 2:30. And on March 3rd, we're going to have our next one. At the last community forum, we noticed that there were a lot of questions and comments around mental health, around behavioral health, about our well-being. And so we're going to focus that one around that on March 3rd. Stay tuned for the times on that. But know that we are doing our best to provide what our community needs. So between now and then, feel free to let us know what topics you're interested in learning more about and having the opportunity to ask questions about. We're here to serve you. We're here, from the Emergency Operations Center, doing our best to respond to our community and the needs. So thank you all for tuning in. Maribel, any closing comments on your part?
No, just thank you to the community. Thank you for tuning in. Thank you for sharing this information. We definitely encourage you, if there was something that you learned here that helped make things a little bit clearer, for you to pass that information to other folks in your network. And again, if there's anyone that who is eligible now or is going to become eligible and may need some assistance in scheduling their appointment, please feel free to either reach out and support them or have them call our 211 so that they can set that appointment. The faster we can get through the current eligibility group, the faster we can move on to the next groups.
Thank you so much. And with that, have a wonderful rest of your Sunday evening. Thank you for tuning in. Goodbye.